thyroid and anti-thyroid drugs. The thyroid gland produces thyroxine, triiodothyronine, and calcitonin. These are responsible to regulate metabolism within the body. Now, producing thyroid hormones is a multiple-step process. It starts back in the hypothalamus, where TRH is produced. That is needed to travel to the pituitary gland, where TSH is produced, and that then travels to the thyroid, where T3 and T4 are produced. Hyperthyroidism. It is too much thyroid hormone, and it can be caused by different things. Graves' disease is one that we hear about quite a lot. And thyroid storm, you might not hear about it, but it is extremely dangerous. It can be induced by stress or by infection, and the person just goes into a hypermetabolic state and can die from it. Signs and symptoms of hyperthyroidism. Remember, they're all related to an increase in metabolism, a hypermetabolic state, diarrhea, flushing, increased appetite, muscle weakness, sleep disorders, altered menstrual flow, fatigue, palpitations, nervousness, heat intolerance, and irritability. How do we treat hyperthyroidism? Well, radioactive iodine is one of the ways we do it. It is injected into the body, it travels to the thyroid gland and destroys it. Or it can be done surgically, where all or part of the thyroid gland is removed. Now, either way, whether they have the iodine or whether they have the surgery, the person's going to have to be on thyroid hormone replacement for the rest of their lives. We also have anti-thyroid drugs, tapazole and PTU. These drugs slow down the hormone production. They can also be used to inhibit the surge of thyroid hormones that sometimes follows thyroid surgery, and that can be life-threatening, or radioactive iodine treatment. These drugs have to be used with caution because they can cause liver and bone marrow toxicity. These medications are better tolerated when given with food. They should be given at the same time of day to maintain consistent blood levels, and people should never stop these medications abruptly. Iodine is important in the formation of thyroid hormone. It comes in at the thyroid level and is used as part of the formation of T3 and T4. So, if it's used to make thyroid hormone, people should avoid eating foods high in iodine, such as seafood, soy sauce, tofu, and iodized salt. Okay, let's switch to hypothyroidism. We have primary, secondary, and tertiary hypothyroidism. It depends on where is the problem. With primary hypothyroidism, the problem is in the thyroid gland. Secondary hypothyroidism, the problem is in the pituitary gland, and it doesn't put out TSH properly. With tertiary hypothyroidism, the problem is in the hypothalamus, and it doesn't secrete TRH properly. We have three kinds of hypothyroidism: cretinism, myxedema, and goiters. Cretinism occurs in children. Quite often it appears at birth. And myxedema happens in adulthood. And goiters can happen anytime. Remember, children are developing. They're growing and developing. If we have hypothyroidism, we have a low metabolic rate. These children have a slow metabolic level, but it also interferes with their physical and mental development. And they will quite often be physically and mentally behind. And this, if it's not corrected, it's permanent. Myxedema and goiters both slow metabolism. Regardless of which one of those are the causes, we're going to see the common symptoms of hair loss, thickened skin, constipation, lethargy, anorexia, but that's combined with weight gain. To treat this, Synthroid, levothyroid, levothyroxine is the common drug, the most commonly used synthetic thyroid product used to treat hypothyroidism. It replaces the hormone, and it works the same way the endogenous hormones do. It's used to treat all three forms of hypothyroidism. And again, levothyroxine is the preferred drug. Its action is more predictable than the other types of synthetic thyroid hormone. It is used after thyroidectomy, after radioactive iodine ablation, as well as after people who just don't have functioning thyroids. Adverse effects, cardiac dysrhythmias is the most severe and significant adverse effect. However, the other signs and symptoms are similar to the signs and symptoms of hyperthyroidism, especially if we're giving them a dose that's a bit too high. So the adverse effects we might see would be heart rate too fast, or palpitations, or hypertension, anxiety, nausea, diarrhea, all the things that we saw with hyperthyroidism. Nursing implications, well, on this slide I'm going to tell you, look at the baseline vital signs. Think about it. If you've changed a person's metabolism, you're going to change their vital signs. And we're also looking at their weight. As we start treatment, we want to be following what's happening with their vital signs, what's happening with their weight. And if they're pregnant, they need to continue with these medications. They also need to continue with these medications if they've got cardiac disease or hypertension, but we need to be very careful. We need to teach people to take these thyroid replacement medications in the morning. They're going to increase their metabolism. Well, they're more likely to keep them awake. So to prevent some of the insomnia problems, you take it in the morning, you take it at the same time every day, and you don't switch brands without discussing it with the physician. We're going to tell them all the signs of what happens if you're getting too much of this medication, and you need to contact your primary health care provider. And we're going to tell them what we think their therapeutic effects will be, and that they're going to take several months maybe before they really see all the effects take place.